morning. I'm going to do an intensive spirometry set today. So today I have the volumetric exerciser. So first off, before I go into the patient's room, I'm going to check their charts and I'm going to see when their medications need to be performed, and then that way I can coincide with the volume exerciser to help them breathe better and get their medication to them properly. So the first thing, I got done with checking their charts, and then I'd always introduce myself to the patient. So I'd say, hi, Mr. Johnson, my name is Amy, and I'm a respiratory care student with the respiratory care department. And so when I'm ready, then I'll wash my hands and dry them. And then I will listen to their lung sounds before I begin doing anything with their breathing treatment. So I listen to the lung sounds, I would auscultate, and listen for any abnormalities that I can find. So when I open up the package, it comes with a little chart. And so I'm going to use me as the patient just to demonstrate on how to properly use it. So here's a chart. And so mine's about 1900, around there is where I need to be at for me. So you take it out of the package. Try not to touch a mouthpiece on anything like the bed or anything for the patient. And then I'll set it at here. I'm going to set it here at 2000 and then see where I'm at. Then I would hook the mouthpiece to here. And for this, you would measure the tidal volume and make sure you chart down where you set them at for there. And then as the patient does their inspired volume, you need to make sure you see how far they get there here, and then see how far they go up the meter here. So when you do this, you're going to have the patient take a deep breath in and an exhale. And then you'll have them inhale, and when they inhale, take an inhale about 3 to 5 seconds when they do it. And when they exhale, just do it nice and slowly, and then when they have to wait until the breech is cleared to the bottom to do the next one. So I'd instruct the patient to do it 6 to 10 times in an hour, or however much they can handle. If they can't handle very much doing it, then we can do a few times, and then we can set goals. So if they can't go very far, that way we can just set a lower goal and have them work towards that goal, and then we can slowly move up to where they need to be until they are ready. So with this, as always, when you're done, set this off to the side. And at the bottom of every machine here, there is a patient name that you can put at the bottom, because this is what they can take home. And then you can put the patient number, the date that you have given it to the patient, because this can help them at home, help them get their inspiratory back to normal. Now this you can just put back in the proper bagging somewhere where it's not going to touch anything or infect anything. And then you would check the patient again, as always. Reassess them, check their vital signs, see where their lung sounds, what they sound like, if there's anything different, if they're coarse, if the medicine is working properly for them with this volume exerciser with their lungs, to get their lungs opening up more and to be able to cough more things up and things like that. And so when I'm done, I would always wash my hands before I leave the room and chart everything on the patient's charts.